caring for the tiniest patients at their most vulnerable time. If you are a neonatal nurse considering an advanced degree, Old Dominion University School of Nursing offers a flexible online neonatal nurse practitioner master's level program.
I decided to become a neonatal nurse practitioner after working at the bedside for about 10 years in the NICU here. And I had seen the other nurse practitioners work independently, but yet with the physicians. I wanted a challenge. I wanted to be part of the medical aspect of the team. I wanted to do procedures. So I wanted to become a little bit more involved in the broader aspect of neonatal care.
I love the babies, but one of the things that I like most is that I have my own patients. I get to manage those patients. I still bring in my nursing expertise. It sort of ramps up being a primary bedside nurse, but you get the leadership part. You get to, work with the families more one-on-one with medical management.
I've met many neonatal nurses that have gone on and tried to become family nurse practitioners or pediatric nurse practitioners, but they're just not passionate about pediatrics or even family. If you have a passion for babies, this is the profession for you.
Nurses who enroll in ODU's Neonatal Nurse Practitioner program learn to perform comprehensive assessments, diagnostic evaluations, and symptom and disease management to care for premature infants or sick newborns in a variety of settings, including transport, acute and chronic inpatient care, delivery room, and outpatient follow-up.
As a neonatal nurse practitioner, you're gone beyond the bedside. You're taking care of the total patient, the family. You have to get more involved in the whole case of what's happening with that baby. And you have to answer all those questions that everyone expects you to have answers to.
The relationship we have with the medical staff, in particular, the neonatologist, is very unique. We get to work side by side with the neonatologist. They listen to what we have to say, the information that we've gathered, our ideas. We round together and then we make decisions together based on what's best for the baby.
Being a nurse by training, it brings sort of a unique perspective. There's a respect and appreciation for what the nurses bring because we've been there. So getting their input to me is always important. They're there 24/7 and I'm not, so I need to bring that into my plan of care.
ODU's neonatal nurse practitioner students benefit from the program director's national and international work in epigenetics, which is the turning on and off of genes.
Through my extensive research and my understanding of genetics and epigenetics, what we'll be able to do is thread that content through the entire program here at Old Dominion. And it is a passion of mine, and I am looking forward to working with students individually so that they learn this content.
ODU's Neonatal Nurse Practitioner program provides flexibility to meet your individual needs. Enroll as a part-time or full-time student. Complete your master's in nursing in 5 semesters full-time. Become certified as an NNP and even continue on to a DNP.
I loved being able to go to ODU and graduate there with my neonatal nurse practitioner degree. It's close to home. The academics there are phenomenal, and you get to work in the NICU at CHKD, which is an amazing facility.
I love taking care of the babies, and it gives me an opportunity to help those families through the most difficult times of having a baby and not being able to take it home because it's been born so early and because it needs so much care in the hospital.
I can't imagine doing anything else. Being able to take care of these tiny babies and make a difference in the lives of the families and the babies, and to see them when they graduate and to see them years later, it is an amazing experience.
The Neonatal Nurse Practitioner program at ODU School of Nursing, preparing exceptional nurses, extending nursing science, and partnering with the global community to provide advanced level nursing care to babies, our tiniest and most vulnerable patients.